Epidemiologists and chronic disease experts tell us that those with underlying conditions such as obesity, diabetes, and high blood pressure are at greater risk for more serious complications and deaths from diseases like the flu, and New Jersey mirrors national statistics on this issue. A recent study of New York City patients with COVID-19 that was published in the Journal of the American Medical Association provides further evidence of this elevated risk. The study examined 5,700 patients hospitalized with COVID-19 in New York. The most common comorbidities among these individuals were hypertension, 56.6%, obesity, 41.7%, and diabetes, 33.8%. Of the patients who died, those with diabetes were more likely to have received invasive mechanical ventilation or care in the ICU compared to those who do not have diabetes. Of our COVID-19 deaths, the breakdown of underlying conditions is as follows. Heart disease, 60%. 42% had diabetes. 20% had chronic lung disease, such as asthma, emphysema, chronic obstructive lung disease. 16% chronic renal disease, 15% neurological disability. 11% had cancer, and 31% had other chronic diseases. Given this greater risk of severe illness and death, the Department of Health is recommending that all individuals who have even mild symptoms that could be associated with COVID-19, such as fever, cough, tightening in the chest, call your doctor and get tested, especially if you have underlying conditions. Today we report 7,240 hospitalizations last night, basically flat over the last 2 days. There are 1,990 individuals in critical care, of which 73% are on ventilators, which is much lower than we have seen previously. I know there is a request for hospital discharge data by location. We are still looking into that, and as soon as we can get that from the discharge data set, we will share that with you. Today we are reporting 4,247 new cases for a total of 99,989 positive cases in the state. And sadly, 307 new deaths have been reported to the department. The breakdown of deaths by race and ethnicity is as follows. White, non-Hispanic, 53.6%. Black, non-Hispanic, 20%. Hispanic, 16%. Asian, non-Hispanic, 5.4%. And other non-Hispanic, 5%. Today, the veteran homes are reporting 5 additional deaths associated with COVID-19. We also are receiving reconciled data from our long-term care facilities. And we are also starting to look at death certificates to reconcile individuals who have died with a primary diagnosis of COVID-19 and or a secondary diagnosis associated with COVID-19. We do expect that you will see on our dashboard an increase in the number of deaths because we are including probable mortalities from COVID-19.